Health professionals are scratching their heads over a current monkeypox outbreak in the United States, Europe, Australia, and the Middle East, and they are worried that it could spread. The majority of new infections have been transmitted through sex, with a specific concentration among men who may have sex with other men. On the other hand, the WHO has warned that the virus is potentially contagious to anybody, particularly vulnerable groups including young children, expectant mothers, and people with impaired immune systems. What is this illness? Infections with the monkeypox virus cause the extremely unusual disease known as monkeypox. The monkeypox virus and the variola virus, which causes smallpox, are the same family of viruses. The symptoms of monkeypox are similar to those of smallpox, but they are less severe, and the disease is rarely fatal. We can rule out a link between monkeypox and chickenpox. In 1958, 2 colonies of research monkeys experienced epidemics of a pox-like disease. Despite the misleading moniker, the origin of monkeypox has not yet been determined. Humans could be infected, though, if the virus is carried by rodents in Africa or by non-human primates like monkeys. In 1970, researchers identified the first incidence of monkeypox in a human being. There had been human cases of monkeypox in numerous countries in Central and Western Africa prior to the 2022 epidemic. Previous incidences of monkeypox from outside Africa were nearly always associated with either travel to a country where the disease is common or the introduction of infected animals. These occurrences took place on several different continents. What causes monkeypox? Although it shares a virus with smallpox, the symptoms of monkeypox are typically less severe. Monkeypox got its name since the virus was initially discovered in monkeys. To be clear, rodents are not monkeys, but they are the virus's principal vector. The International Health Organization has decided to change the name of the disease from monkeypox because of the confusion it causes. The last American smallpox vaccine was administered in 1972. Outbreak of monkeypox. For many years, Africa was the sole continent where cases of monkeypox were reported. It does, however, pop up periodically in places like the United States. The first case of monkeypox from outside Africa took place in the spring of 2003 in the United States. Texas was exposed to an infectious animal consignment from Ghana. From the afflicted rodents, the virus was transmitted to pet prairie dogs, which in turn infected 47 people throughout the Midwest. Infectious diseases that were once contained in certain regions can now spread rapidly over the globe due to the increased frequency in which people from different countries travel to and from one another. For example, a symptom of monkeypox was discovered in a 2021 summertime U.S. citizen who had recently visited Nigeria. In 2022, however, the disease spread beyond Africa, affecting regions as diverse as Europe, the Americas, and Australia. Symptoms. The incubation period for monkeypox is 5 to 21 days. The time from exposure to the onset of symptoms is called the incubation period. The effects of monkeypox might persist anywhere from 2 to 4 weeks. Symptoms may include skin pores, headache, muscle aches, chills, fever, weakness, swollen lymph nodes. The skin may break out in a rash after a few days. The rash manifests initially as tender, flat, red pimples. As the lumps develop into blisters, pus begins to accumulate. In 2 to 4 weeks, the blisters will form a crust and fall off. It's also possible to have oral, genital, or anus sores. There is some variation in the severity of symptoms among people who contract monkeypox. Many instances inside the current 2022 epidemic aren't showing the typical signs. Fewer than usual lesions, no lymph node swelling, lower than normal fever, and other symptoms characterize this unusual presentation. In certain cases, you may not even be aware that you possess it. Prolonged close contact is all that's needed to infect someone else, even if you don't feel sick. How does monkeypox spread? The disease of monkeypox occurs through contact with diseased animals or humans. Diseases spread from animals to humans by contact with open wounds, such as those caused by scratches or with blood, bodily fluids, or pox blisters, sores. In rare cases, monkeypox can be transmitted from person to person. Transmission from person to person happens through close, personal contact, such as kissing or sex, and results from contact with sores, scabs, respiratory droplets, or oral secretions of an infected individual. Whether or if the disease is spread by sperm or genital fluids is still a matter of debate and continuing investigation. Contact with newly contaminated items, such as those worn or used by an infected person or an infected animal, is another potential route of transmission for monkeypox. What is the relevance of monkeypox to gay and bisexual males and other MSM? As per David Heyman, an expert to the World Health Organization, the present epidemic of monkeypox in Europe and North America seems to be tied to two raves conducted lately in Spain and Belgium and attended mostly by gay males. According to Heyman's hypothesis, the virus was spread mostly through sexual intercourse. It would be impossible to separate the two in terms of their respective role in transmission, however, due to the intimate nature of sexual contact. Therefore, during a press conference on May 23rd, the CDC issued a warning to the homosexual and bisexual male population about the apparent global spread of the virus. Is monkeypox a homosexual or gay disease? Monkeypox seems to be spreading today among certain sexual and social networks of homosexual and bisexual men, as well as other men who have sex among men, MSM. In any case, homosexuality is not a contagious disease. Any person, regardless of their sexual orientation, can contract a virus or bacteria. It's also not a sexually transmitted illness. Instead, as previously described, it spreads through personal contact. Anyone can catch monkeypox, especially heterosexual people, women, transgender and non-binary people, and others. It is crucial not to stereotype homosexual and bisexual men and/or Africans as carriers of the disease. Victimization and discrimination and violence is exasperated for marginalized groups like gay and bisexual men and African immigrants who face severe stigma and prejudice. Many nations still have laws that make it illegal to be gay or bisexual, which might make men who have sex with other men reluctant to come out and admit that they do so. This may also make individuals unwilling to admit that they are part of social and sexual groups that are disproportionately impacted by the present epidemic, making prevention of the transmission of monkeypox more difficult. There should be no room for the scapegoating of gay and bisexual men or African immigrants as a consequence of the public health response to this epidemic of monkeypox. Prevention from the virus. To avoid contacting monkeypox or spreading it to others, please observe these precautions. People are advised to stay away from those who have been infected by the virus, as well as those who have just been diagnosed with it. If you have to be in close touch with an individual who has symptoms, use a face mask. You should stay away from any animals that may be infected. Animals with a known history of the disease, such as monkeys, rats, and prairie dogs, are also included in this category. Always wash your hands after using the restroom and after handling any animals or people who may be sick. Use soap and water to clean your hands or an alcohol-based hand sanitizer. Protect yourself with a mask, gloves, and eye protection if you're caring for a patient with a confirmed or suspected case of monkeypox. Consume only properly cooked beef. If you get exposed to monkeypox, the following are some examples of over-the-counter drugs that may alleviate your symptoms of monkeypox. Medication such as ibuprofen and acetaminophen alleviate pain and reduce temperatures. Oatmeal baths, in which colloidal oatmeal is dissolved in warm water, have been found to alleviate the dry, itchy sensation associated with skin rashes. Stay away from other people until all your sores have crusted over. Protect people and the surrounding area by covering isolated wounds with a bandage or gauze. Stay at home and rest while sick. Cover your mouth and nose when you're among other people and drink lots of water. Stay away from rodents and other pets. Is monkeypox curable? Symptoms of monkeypox typically subside within 2 to 4 weeks after initial presentation. Therefore, patients with monkeypox usually recover without medical intervention. After a proper diagnosis, medical attention will focus on easing symptoms, avoiding dehydration, and treating subsequent bacterial infections with antibiotics. At the moment, monkeypox is treated with no antiviral medication. We don't know if antiviral medications are effective in treating monkeypox, but we should try them out. Monkeypox can be treated with one of several antivirals currently in clinical trials. That's all there is for today. Leave us a comment with your thoughts on Is Monkeypox a Gay Disease? Also, make sure to leave a like and subscribe to our channel if you enjoyed the video. Also, click the notification bell to never miss our videos. Stay tuned.